I had a blockage. I needed a bypass, they said. As a matter of fact, I was at work. I came home, I was feeling rough, went to the doctor, and he said, don't go back to work, don't do anything. If you do anything at all, you could drop dead tomorrow. And once you drop dead, we can't help you. And we're going to book you for immediate surgery. And 2 weeks later, I was at 8:30 in the morning, May 8th, I was on the operating room. I had the bypass done.
So your bypass, it took place, and specifically they took a vein from your leg and they put it in your chest.
Yeah, a doctor in Sudbury, he took a vein out of my leg, and I guess he cut it in half because he used two pieces to go a double bypass, so it around the blockages. And to do that, they have to slice your chest open, and he said it'll be open for a while. And they pry it open, and you're for 5 hours on the operating table. So that's kind of strenuous on the muscles and tissues and that, needless to say.
So describe that when after all that post-operative surgery was done, or not, after your surgery is done and you're in post-op, and now they let you go and they're giving you all kinds of medication, I'm assuming.
Yeah, on the way out, because from there on, I got out of the hospital on Tuesday night, I think it was, and I couldn't go home that day because it was getting late, and I had to go get out some prescriptions that filled, so we stayed overnight at House of Kin, and then we headed out. We got halfway home as far as Verner, and I had a real problem then. The pain was so bad, I couldn't stand it, and I got weak, and I took a weak spell, and it wasn't pleasant, I'll tell you. And so after that, we got home, we came the rest of the way. I was in such pain. Oh, never had so much pain like that in my life before. I didn't know whether I was having another heart attack, whether I was going to die. So I took some nitro. All I got was an instant headache because it wasn't the heart. It was the muscles, the dislocated rib cages and stuff that they'd pried open. So, and it was all sewed and stitched, so what do you do? So I come home. So one night in frustration, I said to my wife, look, the world's best cream. That works for my knee, it works on my arthritis in my hands. I said, I'm going to put some on that. And she told me, it's not for that, honey. It's not for sprains and stuff, it's for arthritis. I said, I don't care, put some on. So she rubbed it down my spine, my back, and over my chest where the scar that was now starting to heal. And within 15 minutes, most of the pain was gone. I could tolerate well now. I can live again. And then for the next day, it was good. Then it started to come back a little. So I put some more on. And for about a week, we put it on every day. My wife helped me. Without her, I'd have been dead. And so anyway, now I started tapering off. I did maybe twice a week, once a week. Now, every now and again, I'll get a little twinge of pain, so I'll have her put some on. But that's 3 or 4 weeks, a month apart.